Menstrual cycles all come from the lining of the uterus, which is called the endometrium. When women are finished having children and they're having problems with cycles, what's commonly done is an endometrial ablation where you actually burn the lining of the uterus. The good thing about endometrial ablation is you're not having major surgery. It can shut your cycles down, and it doesn't change your hormones because it's not touching the ovaries, which are outside the uterus. So you're not affecting your hormones, and you're also slowing down your bleeding. And I typically do one of two. One is Minerva, which uses plasma energy, and more commonly an hydrothermal ablation, which is hot water. I see that women's cycles are reduced by 80, 90, even 100%, probably half of women become amenorrheic, which means they no longer have cycles. In terms of adenomyosis, ablation's not so much for pelvic pain. If your pain occurs when you're bleeding, an ablation is going to help with that. Women that have growths of endometrial tissue inside the muscle of the uterus, this is called adenomyosis. And similar to endometriosis, when the growth is outside the uterus, the symptoms are pain. So ablations are not as good for pain unless the pain is isolated to just when you're bleeding. We have an operating room in our office, so a lot of times, even if someone's having pain, we'll do an ablation first because it's so easy to do and it's not going to the hospital, the operating room, but most facilities don't have that, so you'd have to go to the hospital for an ablation, and then if that didn't work, you'd have to go back to the hospital for a hysterectomy. An easy way to tell whether you should just go to hysterectomy, is that what you want? Did your mother have that? And oh my gosh, you felt so much better. The other thing is, have you had pain since you were 14 years old and it's just gotten worse? Do you have pain for 10 days out of the month? Do you have pain in between your cycles? If that's the case and you want to have a hysterectomy, I think that's perfectly reasonable. But trying an ablation first is perfectly reasonable as well because it's such a minor procedure. Hysterectomy requires recovery. Ablation, typically a few days and you feel fine. Now, I'll say one last thing. Since I've been doing this for decades, if I have a patient that comes back and had pain for 2 or 3 weeks after the ablation, I know that she just needs to have a hysterectomy. 10, 15 years ago, I tried to figure it out, and then a year later, I do a hysterectomy. Now, if someone's hurting greatly out of proportion to what I expect, I typically will say, look, let's get to a hysterectomy when you want to have it done. Anyway, I hope that answers your question.